Good afternoon and good evening, good day everybody. This is Dr. Sanjeev Singh Yadav, a surgeon who is doing maximum practice in proctology from the past 2 decades. Proctology is a science of dealing with the anal canal wherein only the anal canal per se is being treated. There are multiple problems associated with the anal canal diseases. As last time we talked about hemorrhoids, now we are going to discuss about fissures. What is a fissure? Why does it occur? And what is the best way to get free of the fissure disease? A fissure is nothing but loss of continuity of the skin area, which most probably occurs at 6 o'clock and 12 o'clock if you take the anal canal as a clock. The reason being, whenever the stool comes out in females because of the presence of uterus above the rectum, and in males because there is no upper supportive system, the sagging of the rectum comes in such a way that the motion comes out in a way that it touches the 12 o'clock or 6 o'clock position according to what I have said earlier. And a hard stool, a stool with lot of pressure, a stool with lot of difficulty, a stool with lot of intrinsic pressure of the anal canal comes out with such a force that it breaks the epithelial lining or the skin lining of the anal canal. That is, as I said, at 12 o'clock and 6 o'clock position. A fissure comes. What happens? Because the skin is sitting on the sphincter or the door of the anal canal, the sphincter becomes highly reactive and causes constriction and expansion, which leads to pain. This constriction and expansion of the anal sphincter, which is because of the chronic irritation due to the presence of the skin lesion, causes a lot of other problems like bleeding. It may get infected and cause pus coming out of that, and ultimately the anal hole becomes very small in size, leading to issues of motion coming out with difficulty. So this small cut normally heals on itself in the initial stages, but if the motion is repeatedly coming hard, if there is lot of intrinsic pressure inside the anal canal, if there is an extrinsic pressure like the pregnant lady or a full bladder, which patients who are sitting on bed or not moving out of bed cannot evacuate properly, this will lead to causing of injury to that particular area, and it becomes a ulcer or a cut like thing, which is why you call it as a fissure in ano. Fissures can occur everywhere. The other reason for fissure coming is anal coitus. If somebody does anal coitus very regularly, if the tear of the skin occurs in all around the anal area, that is the differentiating part between anal coitus and a normal fissure because of constipation or other reasons what I have mentioned earlier. This can easily be identified by a surgeon who sees that there are multiple cuts. More so, and the skin becomes very puckered there. It is something like orange skin appearance which happens there. That way we can identify anal coital fissure and a normal fissure. Multiple tears can also occur in normal individuals. If a large bulk of motion comes out, that can happen if the patient is not passing stool for 2-3 days. If a large bulk of stool comes out, it can tear around the anal area, causing multiple fissures, but the skin doesn't become puckered. That is the differentiation between anal coitus and a large bulk of stool coming. Now the treatment of fissure. You know the reason. The reason simple is constipation or hard stool, multiple stool coming out with pressure. Nowadays we have different genera of people who sleep late, get up late, and in the hurry to go to their office try to push out the stool. It so happens when you are getting late to your office to work. So these are the reasons why you get a fissure in ano. The other reason, as I told you, in pregnancy you can find the fissure coming at 12 o'clock, but if the fissure is not treated properly, then definitely you will get one more fissure or one more cut at 6 o'clock position, because the stool will try to escape in a different direction. After that, what happens, the skin, when the fissure is deep inside, the skin raises like this. This is called as hooding. The skin tries to cover the fissure. This is an indication that the fissure is present. If you see outside, this is not a pile mass. This is not piles as what people tell. Piles are anal masses which are coming from inside the anal canal to the outside. This skin raising is nothing but hooding, which is a classical sign of external tag, as we call it, at 12 o'clock and 6 o'clock position, and it simply suggests that you have a fissure. A fissure can be acute, recent onset because of the sudden hard motion coming out, or any foreign object going into the anal canal, which can tear the anal canal. It can be acute. And chronic injury, in the sense when the fissure is formed, repeated injury leading to a broad based ulcer like thing, which is called as a chronic fissure. Chronic fissures are less painful, acute fissures are more painful. Sometimes the chronic fissure can become acute, in the sense the tear becomes more deep and suddenly they bleed, suddenly they cause pain, suddenly they cause tightness of the anal canal, leading to multiple times patient going to the defecation and leading to more pain, and sometimes they can get infected. This infection will lead into an intrasphincteric or a extrasphincteric or a deep abscess, which can turn into a fistula later on. Many patients have come very late with fistulas, intrasphincteric fistula, extrasphincteric fistula, because once infected, this pus will go up into the layers of the anal canal, causing this fistula like formation. Early treatment by giving laxatives, stool softeners, local ointments, to see that this fissure heals. People use a lot of coconut oil, people use a lot of Vaseline, people use a lot of jellies to reduce the pain. It may help, but ultimately it all depends on how many times your stool is coming out with difficulty. The cure is treating the stool, not treating the fissure per se. If you can manage to eat a normal diet, if you can manage to eat a diet with lot of fiber content in that, if you can manage to eat a diet which is compatible to your body structure and makes the stool soft, the fissure will heal automatically. If not, the only other gold standard is to do a sphincterotomy, which is called as lateral internal sphincterotomy, where only the circular sphincters of the anal canal are broken up earlier through dilatation, which is condemned now, or through open procedure, which takes a long time to heal, or through a laser, wherein a small hole can do the same job what the other two procedures did. This is a permanent solution. Sometimes if the patient is not compatible to give anesthesia, we can also inject botulinum toxin or Botox, which can cause temporary paralysis of the anal sphincter, leading to healing of the fissure. This is a treatment for fissure. It is a daycare procedure. You come in the morning, after investigation, a saddle block is given wherein the only buttocks are involved, and this sphincterotomy is done along with excision of the skin tag with laser. Less trauma, early healing, no need of dressing. Only thing is you have to keep your hygiene proper, because an open wound can lead into infection. This infection has to be prevented. Sometimes, irrespective of the antibiotics, irrespective of the painkiller, irrespective of the local ointment given, some people tend to get infected. There is a possibility that there might be underlying infection, but not every patient can be subjected to MRI. People will ask why MRI was not done before. When there is a clinical sign wherein the infection is noted, without MRI, I don't do any surgical procedure. But when there is no clinical sign, when there is no pain, no fever, no pus, then how can we know whether there is an underlying infection or not? Pain will be there for fissure, but the internal pain will not be there, and every pain cannot be told that it could be infection. So, presence of pus must have a MRI done so that any intrasphincteric or extrasphincteric abscess can be ruled out. But if at all there is infection, there is a treatment where the pus can be drained. Some dressing is needed for some days, and prevention of fistula is one other thing which is needed when you treat a fissure in ano. This is what is fissure in ano. Any pain with bleed or without bleed, regular, continuous, coming and going, without any mass coming out, when the skin tag is hanging around, is a clear-cut sign of a fissure. Consult your doctor and get treated before you go in for a surgical procedure. There are other methods where a flap can also be put, but that we do for a chronic fissure with a big wound, which normally for small wounds is not necessary. So consult a doctor and get your fissure treated before it becomes a magnified issue, creating problem for you 24 hours of the day. Thank you.